Hello, I'm Dr. Bill Lyndon. I work in the Mood Disorders Unit at Northside Clinic, and I'm the Medical Director of the ECT services here. Today I'm going to talk about depression. When patients first see a psychiatrist for their first time, I think they're usually pretty anxious because psychiatric illness carries a fair bit of stigma in the community, and therefore psychiatrists also share that stigma, or share that view that people have that stigma of psychiatrists. So people are usually fairly anxious, but I think people need to understand that it's just like seeing any other medical specialist, that the psychiatrist is going to be interested in them, is going to be interested in trying to understand what it is that they're going through and what they're experiencing. So they're going to ask a lot of questions about how they feel. They're going to ask a lot of questions about their background and their families and their work and their recreation and so on, to get a bit of an idea. So people ought to feel reassured that, number one, psychiatrists are not mind readers. They're not able to sort of, by looking at you or talking to you, get into your deep, dark psyche and know all about you at your first meeting. That's not the way things work. We can only assess people on what they tell us and what we're able to ask them and what their responses are. The role of a family and friends is vital, really, to someone's recovery. People who are depressed usually feel very negative about themselves. They feel quite worthless. They feel they're a burden to their family. They feel that people don't understand them, and often, unfortunately, that's true. I think the community is getting better at understanding depression, but it's enormously important for family and friends to learn as much as they can about depression and its treatment, and to be as supportive as they can to a patient who's going through that treatment. Stigma is an issue. Stigma in the workplace, I think, is probably still more of an issue now than stigma amongst family and friends. I think the community in general are better educated about depression now, but in the workplace I think there are still issues. Because often, of course, people with depression will not be able to perform their job as well, and usually the first approach of the employer is to say, you're not doing well enough, pull up your socks, and so education in the workplace about depression is enormously important, and I know that is occurring in a number of places. Some of the larger corporations are actually doing that, and I think that's a great forward step. But education, I think, is the key. Learning what depression is, learning how it affects people, learning that people aren't responsible for the fact that they're depressed, and that there are successful treatments. I think this is the key to reducing stigma.